You know, there are so many unknowns about COVID-19. It morphs, it changes, and so do the rules. We know one thing, this latest variant is more contagious, and for people who are vaccinated, it's proven to be more mild than other strains. But when you look at the numbers, more children are ending up in the hospital than any other time during this pandemic. Nationwide, over the last month, there has been a 52% increase in hospitalizations in children compared to a 29% increase in adults. Now, of course, more children are getting it, so you see these numbers. But here to help give us more perspective, especially as parents, as we send kids back to school this week, Dr. Sunil Joshi, the head of the Duval County Medical Society Foundation. Thanks for talking with us this morning.
Good morning, Melanie.
So, Dr. Joshi, Duval County, we've said, have changed the rules. Employees must wear a mask, but for the kids, it's only strongly encouraged. What would you suggest that vaccinated kids do when they come back to class here in Duval on Tuesday?
Yeah, honestly, Melanie, whether you're vaccinated or not, I would strongly encourage that our children wear masks when they go back to school, because the environment with COVID-19 right now is significantly different than it was when they left for vacation just about 2.5 to 3 weeks ago. The percent positive cases here in Duval County is now at 27%, according to the Department of Health, whereas earlier in December, it was at 2.5%. So, a significant increase in community spread, which means that our children, who a very, very large percentage of which are not vaccinated, are more likely to spread it amongst each other.
Let me ask you a question, though, because, a lot of parents and children are having a different experience. We put out these numbers. Those are the true numbers that we're getting from hospitals and looking at them giving perspective nationwide. But if they're having an experience where people in their neighborhood, the kids get sick and it's very mild and they feel like, oh, it's just a cold, not a big deal if I get this virus. What would you say to that line of thinking?
Well, I think it is also important to note that, yes, in the vast majority of folks, it is no different than a regular respiratory illness. However, children are being hospitalized at a much higher rate now than they were at the very beginning of this pandemic. And as you just mentioned, there's a 52% increase in hospitalization over the last month compared to the month prior to that, which is higher than at any other time during the pandemic for children, which is a significantly different story for adults. Remember, adults are vaccinated. Folks over the age of 40 have a 71% vaccination rate in this country. Children below the age of 18 have only about a 15% vaccination rate. So that is part of why you're seeing more children in the hospital. Again, it is much more of a disease in the unvaccinated, and the vast majority of our children right now are not vaccinated. And so this whole thought that this virus is not causing significant disease in children is not true. It may have been true at the very beginning, but it's no longer the case, because it's not just hospitalization. It's all these things that we hear about with long COVID and the multi-inflammatory system disorders that are associated with the virus. So again, the vast majority of folks do well, but keep in mind it is important to protect ourselves so we don't get into those situations.
Right. Let's talk about some of those recommendations. You have the CDC saying right now that you don't need to necessarily get tested in order to go back to work and to go back to school. You went from 10 days down to 5 days. Everything is always changing. And parents are also saying, okay, let's say I do send my kids with a mask. Should I do it for the next 2 weeks? Should I do it for a week? What are those indicators that you really keep an eye on in order to make kind of these up to the minute decisions?
Yeah, I think, the important parameters are community spread. So if we're seeing numbers like we are right now, where there's 27% of our tests coming back positive, and over 800 people per 100,000 testing positive in the last week, those are significant. That's an example of significant community spread. In early December, late November, we were looking at numbers at less than 5% positivity, less than 10 in 100,000 people who were testing positive per week. Those are low community spread numbers. So if we get back into that low community spread, which I have no doubt we will soon, hopefully in the next few weeks, then then there's this tendency to maybe back off a little bit more on the mitigation strategies for parents. But right now we're at such high community spread. It makes perfect sense for us to do what we can to prevent the spread of this virus in schools. And that is really, truly up to the parents at this point.
All right, Dr. Joshi, thank you so much. Good information. And we'll be here every step of the way as these recommendations change. Appreciate you.